Ladies and gentlemen, good afternoon. My name is Gilbert Franklin. You could always reach me at 954-667-4885, 954-667-4885. Welcome to Source of Information. We have a great topic that we're going to talk about with a very special guest. This gentleman has been on Source of Information before, and we are privileged to have him back again to discuss about chronic pain, how to avoid it. And you know, it's going to fall right in line with what we're going to be discussing in the next topic. Today, we're going to concentrate on the seniors who's feeling pain and what's the best way of getting rid of them. Let me introduce to you guys none other than Mr. Thomas Griffith, who is a wellness coach at Alto Health.
Yes.
So let's get right into that subject.
Okay. We basically, first of all, we should say that pain is the natural body's protective device.
Okay.
It is there to keep you from doing things which will permanently harm the body or even kill you.
Okay, that makes sense.
Yeah, so if you reach over and touch the burner on your stove, it's ow, you know. It's your body saying, don't do that.
Don't do that. Yeah.
Don't do that. Or if you hit your thumb with the hammer when you're trying to hit the nail, which I've done many times before, again, it hurts, and you say, oh, I can't do that anymore. I don't want to do that. Or I want to get away from this. Or I want to save myself.
Mm-hmm.
That's what we call acute pain. And if you have acute pain from an injury, like let's say you fall out of a tree and break your arm or something like that, you go to seek medical assistance, probably the emergency room, and somebody comes and puts a splint on it and gives you a shot to get rid of the pain, and you're ready to go. Chronic pain is something else. Chronic pain is caused from issues within your body that are prolonged, and the pain just goes on and on and on because you can't get away from it. And that requires a different approach, and there are medical approaches to chronic pain, but there are also what we sometimes refer to as homeopathic approaches, which are non-medicine type of approach to controlling pain. In most of the people that we have at Alto come into the facility for pain.
Yeah.
Very high percentage. In fact, I've been amazed at this flu season and COVID season and all the various things that are going around. We have hardly anybody walk into that office who's sick.
That's a very good point.
Very few people come in who are sick. You don't look in there and see people all like droopy-eyed and handkerchief over their nose and, you know, and kind of, you know. It's mostly because they have pain. And for most of the people that come to Alto, most of those people worked for a living, unlike some people who have, jobs which are supervisory in nature.
Uh-huh.
Yeah.
But when you talk about chronic pain, like most of we're talking about I would say the vast majority of the people in Alto, they're at the age of 65 plus.
Yes.
Plus.
Plus.
Okay. So
they get plus until they get to be my age.
Exactly. So, like for example, most of the complaints about shoulder pain or knee pain.
Shoulder, hips, back, and knee primarily.
Okay.
Knee pain is basically osteoarthritis of the knee.
Okay.
Which is a condition in which the cartilage, which is, you think of cartilage as a sponge.
Mm-hmm.
that protects the actual bone in a joint from friction. It's like you have to think of it in terms of an automobile where you put grease in the joint. The cartilage is that, and when that cartilage wears away, it can either wear away through overuse, or it can be injured, like in sports, and then you start to get what they refer to as bone on bone.
Right.
It can be extremely painful, and it can also distort the knee and can make you crippled.
So in a lot of cases, that's when you go to orthopedic and they say, well, we need to replace those knees.
Yeah, it's gone. It's got to be replaced.
Now, is there some exercise? Because we're gonna give you some examples of exercising, and that you could do. We're gonna take them one by one. Show. We're gonna start with since you already start talking about the knees, so we're gonna talk. Finish with the knees, then we'll go to the hip and the shoulder.
Right.
So we're gonna work our way up, down, and up.
Down and up. The knee is probably the most difficult one to do pain relief on, mainly because when cartilage is gone, it's gone. What we try to do is, number one, is protect the knee from becoming distorted, meaning that if you were to take the knee like this, sometimes you'll see people who the knee turns in like this or turns out, and so the leg is it has a bow in it or a bend, one way or the other. When that happens, you're pretty well done for. You're going to have to have a knee. You're going to have a knee replacement.
So let's take it from before we get to that point, because once we get to that point, yes, the knee replacement is definitely, and it's a very expensive procedure.
Very expensive procedure, and by the way, not a very pleasant one.
Yes.
The rehabilitation is long and gruesome, and joint replacement is not 100% effective. Knee is probably one of the best one, particularly with the new knee that they have. The knee has just came out about 2 years ago. It's a great improvement over the old knee, but still, it has to be, the old knee has to be cut out and the new one put back in. Okay, and so that's, if there's anything you can do to get away from that, you want to do it.
Now, is part of the, many years ago, I went to an orthopedic with one of the patients, and she wanted to get some. She wanted to be comfortable with the decision she was about to make to replace the knee. So I went there with her, and at the time it was two metals that basically they were showing, or not necessarily metal, but more like plastic.
Carbon fiber.
Carbon fiber.
Yeah.
Okay. So that was being done.
It's the same thing they make the space shuttle out of, by the way.
Yeah. So I think back then, what we realized that the weight had something to do with maintaining the knee in a healthy place. Because if you have the excess weight that you're carrying around on a daily basis.
Well, yes. If you're a person who is, take myself for instance, back when I was 23 years old, I was trying to qualify for a professional tennis tournament.
Mm-hmm.
And on the last point of the match, I hit what they call a kick step overhead. I was successful. I won the match, fell, and tore my medial meniscus. And had to be operated on.
Okay.
My natural weight is about 140 to 145 pounds. That's genetically what I'm designed to carry.
Okay.
Right now I weigh about 143 pounds.
Are you showing off?
Now, if we have a member in our family is the same height as I am. Has a very similar genetic background to me,
Okay.
and he weighs 340 pounds.
And how do you explain that?
How he weighed 340 pounds?
Yeah.
You eat too much,
Okay.
too often. Or,
So the point is that you're trying to bring to our attention is that you have to control your diet.
you have to control your diet, and you have to control the amount of calories you input, because, I mean, in the classes we have in Alto, we have a saying, more weight, more pain. Less weight, less pain. So the more weight you have, the more you weigh, the more pressure you put on your joints, more pressure you put on your back, the more that pain is going to grow, because those joints were not designed to take that kind of weight, and they're going to rebel. And eventually they wear out, eventually they break. And when they wear out and break, you're going to have a lot of pain. And like I say, knees are one of the ones most susceptible to excess weight, although your hips and your back is too. You know, I have a patient there at Alto who has a very large stomach. And
Ordinarily, the stomach is the hardest part to get rid of.
Yeah, and well, not necessarily.
Okay.
Where you put your weight is based on genetics. Some people put it out in the stomach. Most men do. Women oftentimes carry it in the hips, in the butt, and either way, whether the weight is in your stomach or in your hips, your knees feel it. Now, in the case of males who have large amounts of stomach fat, they're obese in the stomach, big guys out there like that, that pulls on the back because that weight is out in front of you. It pulls the back in, and that can be very, very painful.
Good point.
Yeah. So the old saying, the beer belly, even though you can get a beer belly without drinking beer, by the way. You can eat a ton of rice every day and you get a beer belly. But that belly out there pulls on your back, it pulls on your hips, and you get what we call the IT band, which is right across the top of your head. Can I stand up and show you?
Can you zoom in for me?
Yeah. If we talk about this area right in here, which is very...
The lower back.
Yeah, the lower back.
Turn around so they could see it.
Yeah, right here, right where my belt is. I don't have much of a waistline, so
Okay.
pants fall off. There, right there. Okay, if you get pain in that area and you have a big stomach, that's probably what the cause of it is.
Okay.
And it's a very, very difficult area to eliminate pain.
So we're going to zoom in. What exercise would you recommend?
For the knee?
Jean-Robert,
Yeah.
you're going to zoom in for me. He's going to demonstrate an exercise that you could do to alleviate the back pain.
Well, let's go to the knee first.
You want to go? Oh, yes, I'm sorry.
knee, yeah.
The knee.
Okay, knee work is actually pretty simple. And one thing which you don't want to do is go to a gymnasium or a gym, or a spa, and get on what they call the leg extension machine. And the leg extension machine, can they see me here?
He's going to zoom in. Go ahead.
Go ahead. Is where you put your leg.
Drop back a little bit more. So, okay.
Right there. You put
Yeah.
your device right here on your ankle,
Uh-huh.
and you extend up like that. And there's a weight back here, and it exercises this area.
Uh-huh.
This is the area you want to exercise, but every time you go up and down,
It affects the joint.
big time. Now, it's great if you are 18 years old and you have no injuries and you want to be a track star or something like that. That works really well. But once you have an injury or once you get past a certain age,
And that certain age is?
certain ages, I'm very conservative in that range. I say a certain age is around 35 to 40.
Okay.
Once you're past 35, you start to watch what you're doing. If you don't, you will pay the price when you're 65.
As you get
70.
older.
That's right. So what we do is what we call an isometric exercise, whereby the leg is kept straight. And there's two ways of doing this. You start with the leg with the toe down, like this.
Is there any way we could get a camera to
Here.
drop back a little bit so they could start back with extending the leg?
Yeah. This is the one you don't want, okay? That's the one you don't want. The one you want is with the leg straight. And keep the leg in front. Don't have it out here, right? If you have it out here, then you're training your hip. You're strengthening your hip out here, not here. This is where you walk, right here. Okay? So, you start with your toe down, as far down as it'll go. Your leg is straight, and you just lift. All right? Now, once you get strong enough that you can do that without any problem, you put a weight on the end of your foot. Now, what kind of weight? It doesn't matter. You can put, back in the days when we had yellow pages,
Yes, you should.
you throw the phone book on there, and up you go, you know? Now,
Are you able to find a yellow page nowadays? That's okay.
you anyway, you put that toe down, and you just keep going up, and you can put your hand right on this,
The upper thigh.
the upper thigh called the quadriceps groove, and you can lift up, and you can feel all those muscles working in there. But, so you're strengthening this muscle, but you're not putting pressure on it. The muscle you really want to get is there's two muscles which run down with ligaments which hook over the side of the knee. All right? This is your lateral and this is your medial, okay? The lateral side, medial side. Okay, so you're lifting that up. And as you do, you're strengthening these muscles here. Now, what do these muscles do? They hold the knee in place. So, when you walk, the knee doesn't slide inside here because it doesn't have the cartilage there to hold it in proper position. So when you walk, it wants to go like this. All right? This muscle gets tight. It keeps that muscle, that joint in there, and you're going to, okay? Once you've done this one, then you pull the toe all the way back. Now you're working back here, what we call our hamstrings group. All right? So up you go. Same thing. You know? Up you go. So it strengthens back here through what they call the popliteal fossa down here. These muscles down here. Up you go. Up you go. Up you go. And then we want these. Out we go. Out we go. You can also use a band, and you can lift the leg up and do these, okay? In our class, we call these Simons, because we got a guy in class named Simon, and he can't do it very well. So if you're in our class, you can't do it. You get the exercise named after you. So these are Simons, all right?
All right, that's
So
good to know.
So that strengthens all these muscles, which keeps the knee in place. The less the knee goes around like that, the less pain you have. But we also do some massage therapy in this area here, which keeps the blood flowing and circulation in that area. Circulation is one of the key factors in relieving of pain. The more circulation, the more nutrients you get to the bone or to the area, the more oxygen, the more nutrients, and then the more healing that can take place.
So when somebody joined the clinic, the first thing you would recommend is start exercising, especially like we have it on Monday, Tuesdays, and Thursday.
Just general exercise.
General exercise to strengthen the legs.
Yes, you want to straighten the leg all the way, okay?
Okay.
But what I do is we have, come back up here.
Yeah,
okay?
come back here.
I'm coming back up here. Okay. That was a interesting floor direction there. Anyway, yeah, and then a person says, my leg hurts. We have a patient there whose leg is like this,
Right.
and so we don't want it to get any worse. So what we try to do is try to get them to do these exercises, or we'll take them back to another room and put weights on their leg, and they do the same thing that we just did there, only with proper weights.
Okay. Okay. Now let's talk about let's talk about the hip now.
Okay, hip is a different animal than the knee. The hip is much stronger. Plus, it is a true ball and socket. So you have your socket up here, and the ball sticks in it. All right, and unlike the knee only goes like this. The hip goes around and up and down. So, and it has a whole bunch of muscles in there, and there are just 2 or 3 muscles within the hip that are the guys that really cause the problem, and unfortunately, they're all deep inside the hip. So we use, for those, you do strengthening again, but stretching becomes very important.
But before we get there, what caused the hip to get? Is it an accident, or again, weight? Does weight play a factor?
Weight always plays a factor. Weight is always plays a factor. But most of the people that we have in the clinic right now, it's work-related trauma.
Okay.
So otherwise, we have a lot of people, like I say, who worked for a living.
No longer working.
No longer working.
Right.
But let's say we have a lady there who worked for
Hotel industry.
a hotel industry owned by a certain individual, which we won't mention that one. For 40 to 50 hours a week, she had to push that cart
Push that cart. Yeah.
up and down that hallway. That cart is not light. And by this constant pushing, these muscles in her hip have become damaged. And what happens when muscles become damaged? You get pain. And the body says, oh, you're going to push that cart anyway, so let me redirect how you're going to push the cart. And so you get other muscles then that are overworked. That causes pain. But then the muscles that you injured to start out with atrophy, and then you have pain. So it's a case not just of one muscle being damaged, it's a case of compensation, which creates problems on the other side. So if a person comes to me and says, this hip hurts, I look at the other hip and I've got problems there too. So
Because it's overcompensating for the
yes,
hips. That's
yes. So you work for 10 years and you ruin your hip. You work for another 10 years, compensating for the hip that you ruined the first 10 years, and you ruin the other hip. I would say this is very common. Now,
let me take a quick break for a second. 305-945-1580, 305-945-1580. The line is open if you have any question regarding what he's doing. And don't forget, we are streaming live right now on WSRF 1580 AM. Subscribe, like, make sure that that same video you share it with a friend so that they could prevent from when they get at the latest stage of their life, they don't end up in a nursing home because they can't take care of themselves because of the knee problems.
Or any of these problems can put you in a nursing home.
Exactly. So please, WSIF 1580 AM. We are live on YouTube and Facebook, so you could go on there, subscribe, and show us your appreciation that way. I know a lot of you guys are listening right now and say, well, you know, I'm listening, but I don't call in. Okay, that's fine, but make sure you subscribe, go online and get that. So let's discuss the exercise because I'm anticipating we're going to get calls, so I want to make sure that we cover the three areas fully before we start getting bombarded with calls. Mm-hmm. So for the hip, what kind of exercise do you recommend?
Yeah, we've got a small muscle in the hip that is the bad guy. It's called the piriformis muscle. Mm-hmm. And it's a really short muscle, which it's maybe that long and about that wide. And it has a lot of problems. And it's a double whammy because a nerve called the sciatic nerve runs right next to that muscle. And when that muscle becomes inflamed or it expands, it touches that nerve, mm-hmm. and you get sciatica, which is a pain which runs from the top of the hip all the way to the end of the toe. And it's a very peculiar pain, and it feels like you stuck a screwdriver into a light socket. And it's like a jolt of electricity down your leg. And I've had people tell me that they'll just be sitting or laying in bed, mm-hmm. and all of a sudden the leg will just fly up, and it's very painful. So basically, in the hip, we do massage or manipulation to get blood flowing in there, get circulation in there, get nutrients mm-hmm. to those muscles, and then we stretch. We do a whole bunch of different stretches. There's about 5 or 6 stretches that are specially designed for the piriformis. They all work, and you try to find one that works for the pace that you're working with. And unfortunately, that particular type of therapy requires somebody to help you. That's a pretty much a two-person job, mm-hmm. Because it requires lifting the leg and manipulating the leg. But we can certainly relieve that stress quite a bit. And I've mentioned this word twice, and that's nutrients to the muscle. And your blood can't supply you nutrients if the nutrients aren't there.
Okay.
And when you are in pain and exercising to try to build up your muscles or stretch them out to get rid of pain, it's very important that you consume a sufficient amount of protein.
Now, so give us an example of the exercise that's going to help you with the hip.
Okay, one that we do pretty easily is, whoop, what happened?
That's okay, we'll fix that.
Okay, we'll fix that. I don't need any. Okay, one is very simple, and just bring your leg up like this, okay? Now, right now, if you're doing this, you're going to feel a stretch way inside your hip. You got that one? Can you see it? We good?
Yeah, we're good.
Okay, that stretch you're feeling is your piriformis muscle. It's right up inside, all right?
Move this way a little bit.
Yeah.
Yeah. Okay.
Now, if you take your arm like this, and you just pull it up, and you feel that muscle.
So in other words, you put your arm around your leg,
Yeah. And just pull it up.
just around the joint, and lift it up
Lift up. And you can feel.
from your buttocks up.
Yeah, you can feel that. You right there. You can feel it. That's the guy. That's probably the problem.
The sciatic nerve.
Yeah, the sciatic is the nerve. The piriformis is the muscle.
Okay.
So the piriformis being messed up messes up the sciatic nerve. Okay? There's another one we do too, is if you just take your feet and you can cross them just like that, and then you're going to go to the side of the chair like that. And then the other side. And then pull up like that. But then another thing you can do is just relax your arms and hang down. And you can feel this right across the back stretch out. Okay? So, if you've got a bad knee and you do those exercises, that's going to be good for your hip as well. So, and then we also do a thing called a doggy.
Mm-hmm.
And a doggy looks like this. You always hold on to a chair, by the way. And then you drop your knee down and raise it up. Okay? Like that. And then we do what we call a butt buster. And you bring your toe way back here like this. And you bring it up. And then you're going to feel that muscle work. Right? Just like that. And you can't do too many of these, okay?
Why?
The more you do, the more you strengthen, and the more you get circulation to the hip, and the better it becomes. Okay?
So you should do as much as you possibly can.
Yeah. Now, if it gets too easy, you can get some ankle weights. We have ankle weights at Alto, and we'll put an ankle weight on somebody, and away they go. Now, you can come and do the same thing, similar, in the front, and we do this exercise, which we bring the toe back, we bring it forward like this. You're exercising the hip, but you're also working on your balance, which is a different subject we can cover.
That's a very important subject because a lot of people end up in a nursing home because
Okay.
of lack of balance.
Strength and balance keeps you out of the nursing home. And a fall is a bad thing.
Right, because you injured so many part of your body, especially your vertebrae, the
Yes,
disc in the
okay.
vertebrae.
We have a patient at Alto that I think has a cracked coccyx, which is that never healed, right?
Mm-hmm.
Probably did it when she was, I don't know, 30 years old, and she's 70 years old now. And from time to time, it hurts.
It's not an easy pain. It's not an easy pain.
Yeah. And you go to the doctor and say, I cracked my coccyx. They're going to go,
There's not much we could do.
yeah, I'm sorry about that. But there's nothing that can be done with it. Yeah, it is what it is. But so the best thing to do is not fall. Shall we go into the back?
Let's go. Yeah,
Go to the back?
yeah.
Or the shoulder? Which one?
No, we're going to go. You just did the back, didn't you?
No, that's the hip.
That's the hip. Let's go to the back then.
Yeah. Back is back problems almost always come from work-related injuries and generally
Falling.
falling and weight. Weight is really hard on the back, but also improper working technique. When somebody's screaming at you to get the shelves stocked or
Yeah.
you don't always think about technique. And also, I hate to say this, but not all employers are cognizant of safety regulations and rules designed to protect people's back. I once watched a woman who was about 8 months pregnant fixing burgers at a McDonald's on Southwest 8th Street. And no mat, no nothing, and the floor was so wet she was sliding around.
Roller skating on the floor.
Roller skating on the floor, and the manager was up front, and I told him, I said, if you don't put a mat on that woman's foot, I'm going to report you. And he went back and put a mat back there. But it's just an oversight that's unfortunate. Well, you're back there fixing hamburgers 8 months pregnant, and 30 years later, you're going to have a sore back. Count on it. And of course, we can't discount for women the effect that pregnancy has on back.
And back,
Yeah.
exactly.
And if proper rehabilitation doesn't take place after pregnancy, which 90% it doesn't,
Right.
you're going to have issues, and you can also have issues with the hip, the hip where the kid sits on the side of the, So for back, we do weights and, massage and stretching. One problem that we see quite often is because of people pulling down and pulling up like this, that these muscles in the back, right back here, become really tight and inflamed. And so when you put your hand back on somebody's back, there's a big valley there.
I'll turn around and show them exactly what you.
Yeah. Okay. My back is pretty flat here.
Turn around. Keep.
Right there?
Yeah, right there.
Okay. My back is flat.
Mhm.
Right. I can
Right.
put my hand right there.
Mm-hmm.
I have no back pain. But when you somebody comes and says, I got back pain, and there's a deep V there, like this, and sometimes that V, I've seen them 2 inches. That person has severe back pain.
And so, how do we remedy that?
Mild stretching, weights, walking is great for the back. And you really have to have some sort of manipulation, some sort of massage or something. Massage can relieve. It's like a muscle says, "Oh, I got this knot here," or "I got this. It's all tightened up." And somebody comes and sticks their thumb in it. And of course, it's hard to stick your thumb in your back, And the muscle says, "Oh, maybe I'm not supposed to be doing this," and it relaxes. It's weird, but anytime you go to any kind of therapy, the first thing the therapy is going to be looked for is hard spots, knots, bumps in the muscle so the first thing it does when it finds that bump, it's going to stick its thumb. It's going to stick their thumb on it and push on it until it goes away. And And then, of course, the person goes, wow, I feel better already. Now, it'll come back unless you continually do things. I always tell people, they come in, they say, oh, my back is killing me. Then you work on it, and they go, wow, that's great. That's great. I feel much better. I said, look, it took you 30 years or 40 years to mess this up.
It's going to take you another 30 years.
It's not gonna, you're not going to do what, we're not going to fix that one day. And, you know, like Doc says, people come in with pain, and they kind of look at him and they expect him to go, and they're done. They walk out, you know? It doesn't work that way. It takes work to eliminate those issues, and, you know, and some work on your part.
Let's talk about the shoulder for the remainder of the time that we have left.
Okay, shoulder's a good one, particularly with our clientele, because so many of them worked in housekeeping. Doesn't matter if it was hotel,
Laundromat,
hospital,
factory,
whatever it is, it doesn't matter. Imagine, those of you who have never worked in housekeeping, you're going to a bed, imagine your own bed, and you rip the sheets off. You put another sheet on, and it's a real pain. I hate doing it because I have to help my wife do it, you know.
So when you do that gesture, are you referring to tucking the sheet?
Yeah, tucking
underneath
the
you?
sheet in and pulling it. All the stuff you got to do. And then you put the other one on. Then you drag the
dirty clothes, the
bedspread, which weighs 20 pounds, and you throw it over there, and you like that, and you know, one time, no big deal. 40 times a day, that's a big deal. And then, what you got to do is you go out and push the cart. I had a woman who worked in a high-rise in New York City, an office building, 80-some stories, and her job was to clean the bathrooms. And one day, that was it. Locked up, it was done. Wore it out.
She could file for disability.
Yeah, she could have. I don't know if she did or not, but when I got her, it was like this, can you do something about this? We were able to get minimal amount of usage back. But the problem with the shoulder is medical responses to shoulder injury tend to be not very successful and don't last very long. For instance, people go and they go to the doc, and the doc says, what's the matter? And then, well, we can give you a cortisone shot.
Which is temporary.
Stick that needle in, and you feel great, almost instantly. The next day you're like this. But before you leave, the doctor will say, this is good for about 90 days. And during that 90 days, you need to rehabilitate your shoulder. Well, because it feels so great, they don't rehabilitate. After 90 days, go back to the doctor. It's all painful again.
Mm-hmm.
And the doctor may or may not give you another shot. But if he does give you another shot, he's going to say it's only good for 45 days or 2 months this time. Because the second time is never as effective as the first time. And by the time you get to the third shot, most doctors won't even give them to them because it's a waste of time. No. So once you get that shot, you got to rehabilitate. Rehabilitation of the shoulder. We have how much time we got?
10 minutes.
How much?
8 minutes.
8 minutes. Okay, we're going to go through the shoulder. The rehabilitation shoulder exercises are so easy and so simple you can't believe it. All right? So you start like this. Got it? Imagine you're pushing a weight down. And you're going to push down, just like that. And you do it maybe 5 or 6 times. Okay? Then you take that elbow and you stretch it back like this. And then you take your fingers and you touch your shoulder. And this seems very, very simple. And Gilbert's probably sitting there thinking, what does this do? If Gilbert were doing it right now, he would feel his shoulder really working hard. So then you straighten it like that. Wow, huh? And that one you really feel. And then you bring this hand up like this. And now you're going to rotate. And then out you go. Okay, that's one set of exercises for your shoulder that builds strength in the shoulder and stretch and elongate the muscles at the same time. The shoulder is not a ball and socket joint like the hip. It's a flat piece of bone like this. And the arm bone sits up here, and it can go up and down and around and all this sort of stuff, wherever you want it to go. And it's controlled by a group of muscles called the rotator cuff muscles, but it's not the only one. And those muscles have to all be stretched out and strengthened. So we do another one where this is just the common stretch, and everybody in the class knows this one. Start there, there, cup your hand like this, there, back, lift, back, up, over, hand next to your ear, straight up. That's one of the best pain relief exercises for the shoulder you can do. There are a couple of others. We'll do just one. Just take your hand up like this, bring it down, stretch up. That stretches this area right here. If by chance you've had a mini stroke, probably affects this muscle right here. Great exercise for that. Lift up. And then you want to stretch your infraspinatus muscle, which is one of your rotator cuff muscles, over like that. We do those in our class at Alto, every single class. We do those exercises. And it works. Now, again, we go back to, and I recently bring this up because I think a lot of people out there listening probably did work in housekeeping.
Mm-hmm.
For whatever reason, housekeeping in females, women, destroys the big belly of the bicep. And and the bicep, very difficult to stretch. So we use weight training to build that bicep up, and as well as massage and vibration to get lots of nutrients in there, lots of oxygen. And of course, again, particularly with the bicep and these big muscles like the infraspinatus and subscapular, those big muscles in the shoulder, very important, you get the protein. Protein, protein, protein.
Protein. So the protein is going to help strengthen the muscles.
You can, if you do exercise and you have no protein, we have a patient who does not consume enough protein, and I'm on her about it every day.
Bring that to my attention, and then we find out what's in the OTC that she could order on a monthly basis, so she could get a sufficient amount of protein to help her get better.
The problem with protein is, of course, it's expensive. But I'll just throw this out. We just have a minute or so left. One way that you can get super high quality protein, and it costs literally pennies a day, is through lentils. You can make a big pot of lentils that will do you for 4 or 5 days for a couple of bucks. And you will absolutely get all the protein you need, because lentil is the only vegetable or vegetarian-based food that has a complete protein. So, eat your lentils, fix your body.
Thank you very much. I think it was very informative, the exercise, and we definitely have to do it more in the future this year. So we got to plan better to have you back, and especially we getting a lot of the population now by not taking their blood pressure properly, or the blood pressure is not regulated, end up getting a stroke. So we want to prevent that. Again, my name is Gilbert Franklin. You guys could always reach me at 954-667-4885, 954-667-4885. Although we didn't have any call, I guess you guys wanted to concentrate on listen to what he was saying, what Tom was saying, and also watch on YouTube and Facebook Live. Go on to YouTube and Facebook Live and abonne or registered. It's very important to us here at the studio, and so we could continue bringing you that information on a weekly basis. Again, my name is Gilbert Franklin. You could call me at 954-667-4885, 954-667-4885. I love you guys. A bientôt. Bye-bye.